Good afternoon, everyone. Thank you, ma'am, for giving me this opportunity and guiding to make this slide also. So I shall be talking about misoprostol in the first trimester of pregnancy. So we shall be talking about misoprostol. Misoprostol is a very commonly used drug by all of us. It is a synthetic prostaglandin E1 analog. It is cheap, easily available, सस्ती है, widely available है, room temperature पे stable है. And the most important part is that you can give it through orally, sublingual, buccal, vaginal, anyway. So, when I was going through the presentation, जैसे हम लोग, we are being gynecologists, I know that it is a very widely used drug in gynecology. But another and interesting use of misoprostol is to prevent gastric ulcers, facilitated by the NSAIDs. And of course, for our specialty, we know that it is used in the medical abortion in the second trimester, then again in the third trimester for induction, for prevention of PPH and everything. Mechanism of action, ma'am, because it is very interesting, so I have just written it that for gastric ulcer, it stimulates prostaglandin E1 receptors of the stomach and directly prevents the mucosa from getting affected by the acid. And as far as uterus is concerned, it is a smooth muscle binding agent, so it causes smooth muscle contraction, causes the degradation of collagen in the cervix. And so the basic things which we require is uterine contraction as well as cervical dilatation. Both are caused by the misoprostol. One must very importantly know the pharmacokinetics also about a drug, which says that it is easily absorbed and the plasma concentration is maximum between 12 minutes to 3 minutes, and the action remains for about 3 hours. That's why we all know that when we repeat the misoprostol, it is generally after 3 hours that we repeat it. Okay. So, use of misoprostol in the first 12 weeks of pregnancy. As we all know that we have been over the ages using, and the WHO also recommends the use of misoprene 200 milligrams, followed by use of misoprostol 24 to 48 hours later, vaginally or sublingually. As far as I am concerned, I use it after 48 hours only. And there is a misoprostol only regime also where where we don't have misoprene. There we use 800 microgram of misoprostol every 3 hours. Yes, ma'am, 3 doses. So this is the PIGO recommendation, and I will only be considering about the less than 12 weeks. So if it is a missed abortion, you can use misoprostol 800 milligrams 3 hourly, every 3 hourly till the products are expelled. And yes. And in incomplete abortion, we give 400 misoprostol. It depends how much the dose patient requires, how much dose the patient requires. And we can safely repeat it after 3 hours. This is again repetition of the same thing. One thing is there that in incomplete abortion of less than 13 weeks, a single dose of 600 microgram of misoprostol or 400 microgram of misoprostol sublingually can be given, and it is also recommended by WHO. Ma'am, though in practice, whenever I get a RPOC on ultrasound, I recommend that take 200 milligram of misoprostol twice a day for 2 days and then wait for 3-4 days and see how the expulsion occurs. So it is a very high success rate in the first trimester, and it is seen that if it is given properly, more than 90% of the abortions are successful, and if they are done within 7 to 10 days with correct doses, then follow up. And it can be used for missed abortion and embryonic gestation, and it has definitely edges over the surgical procedure because monetarily also it is beneficial for the patient, and also it prevents the patient from the risk of surgery. Misoprostol, as I've already said, is a safer alternative to DNC in many of the rural and low resource settings. So common side effects, as we all know, is diarrhea, abdominal pain, nausea, vomiting. Still, the misoprostol is used for treatment of ulcers. I was really कैसे use होती है, but yes, it is used. And shivering, the most hardly I have seen any case of severe reactions with misoprostol, but shivering, as we all know, whenever you give post-cesarean, when you give patient the misoprostol, the patient has shivering, chills, hyperemia, headache, and you can just counsel them that it will be over within 15-20 minutes because the half-life is only of that much. So these are the moderate to severe reactions which are hardly seen, but yes, if the patient is more than 13 weeks and if you just use it unjustly, then it can lead to severe uterine contractions, pain, vaginal bleeding, and it can lead to precipitate labor also. So one must be also aware about the contraindications are associated with premature birth, congenital abnormalities. Okay, this doesn't involve me. And if it is a known, if the patient has known hypersensitivity to prostaglandin, it should not be given. Misoprostol is a versatile, affordable, and a life-saving drug, effective across all the trimesters postpartum for various indications, and crucial for resource-limited settings due to stability and ease of use. Thank you so much.